Good morning, everybody, and welcome to another episode of Noah Knows, the science of health and fitness. Today, we have a very special guest. We have the globe-trotting and time-traveling Astrid Naranjo from Australia. Welcome so much to the show. Thank you for being here, Astrid.
Thank you so much for having me, and I'm so excited to be here as well.
So, for those of you who don't know, the reason why I mentioned time travel there is because it's actually the next morning for her right now. She's in Australia, so it's roughly 6 o'clock our time. What is it, like 8, 9 o'clock in the morning where you are right now?
9 a.m.
9 a.m.
Yes.
The following day.
Yeah.
So it's Monday for us, Tuesday for you.
Yes, correct.
All right, so welcome to the show. Masters in Nutrition and Dietetics, fantastic, specializing in women's health. So, the first guest I ever had on the show was a good friend of yours, Alan Aragon. He's done some incredible research, and he's an industry leader. I know recently you did some work with him. Can you tell us about that research?
Absolutely. It's been a real honor for me to work with him and produce some of the really nice articles I've been able to work on for his monthly review. And I'm really enjoying working with him, getting to work with this amazing human being. He's not just an amazing researcher, but he's also an amazing person. So what I've been doing with him is basically I started writing down about bariatric surgery and how it is basically a lifelong journey. It's not just something that is like a quick fix. And then I started working on a women's series that he was really happy for me to work on. So I started on PCOS. Then I've been I did a little bit of work around menstrual cycle and how it syncs with the nutrition and training, and how can you kind of periodize nutrition and training around menstrual cycle to make it more effective. And it might work in some women very good. And recently I've been working on menopause, which is like my next project, my next article for the next probably the next month or so will be released or published in his monthly review.
That's fantastic. I've followed your and his research for a while, and you guys really put out high quality content, quality and quantity. So I'll be looking forward to that. And we can get into PCOS and menstrual cycles and all that stuff in a little bit. But one of the things I want to capitalize on real fast, and it's a question that I get asked on a regular basis, and I'd love your input on this, and it's what kind of effects do birth control have on weight loss, and can women ever take advantage of the changing menstrual cycle and hormones that happen to, like, should they be changing their routine? Should they be changing their diet? Walk us through that.
All right. So if we talk about the hormonal replacement therapy, or even talking about contraceptive hormones, we know that they will affect at some level everything that is related to the normal cycle and the normal rhythm of the hormones. So you'll see that a normal rhythm will have fluctuations of the main hormones. Let's say estrogen and progesterone, they will go up and down at certain points of the cycle. But when it comes to talk about the use of external hormones, they will definitely have an impact and change the fluctuation. And you'll see that you normally see that fluctuation is not normal. It's not no longer normal. It is more like stable and very, very little changes along the menstrual cycle. So you might see that there is not much to do in terms of periodization or strategies when it comes to the menstrual cycle and using of contraceptive hormones. But when it comes to do the same sort of strategies with women that are just on a normal regular periods, it is much easier to kind of identify when is the first day of the menstrual cycle, and identify or like break it down in 4 phases, or either 4 phases or 2 phases, depending on how you want to look at it. It is all relative to the levels of progesterone and estrogen, which are the kind of the main protagonists or hormones that are going to have an important impact in their level of stress, the level of how women feel throughout the menstrual cycle in general.
Okay, fantastic. So, in an effort here to get our viewers who are available and listeners to relate to you a little bit better, I wanna touch on something that I actually did with Alan in the first episode as well, and I wanna create a bond, right, or show that we all struggle together. And I know Alan used to be overweight, and I know you've been since a very early age. You became like a personal trainer at like 13 or 16 or something like that. But
absolutely, yes.
Prior to that, you actually spent a little bit of time being overweight. And as I recall in other podcasts, you mentioned that the changing point for you was when somebody made some sort of comment about your weight. What sort of things were you doing to have you become overweight, and what did you put in place to start to lose the weight?
All right, so it was in my early ages of adolescence, so I wasn't really paying attention to my habits or my food intake or the quality of the things I was putting in my mouth, and I wasn't even like focusing on training consistently or exercising. So it was a little bit of the normal adolescent that you see that is not really engaging in any of that until they actually get into puberty, and they started getting into noticing that their surroundings are noticing you a bit more, and like your breasts start growing, you start feeling like you're more like a little woman, that is start you just start feeling you notice a little bit more. And like my experience was like I'm always been, especially in when I was little, everyone was complimenting me and saying, "Oh, you're so beautiful. You're so pretty. You look very, very beautiful today." And like even in the streets, it is normal in South America. Like if you're walking, people say, "Oh, I don't know." They give you some compliments or scream, "Oh, I don't know, something a little bit more gross." But like they talk to you. And it's kind of a way you feel like, oh, I'm looking good today. It's sort of a really nice compliment. So I guess one day out of nowhere, I was doing the same thing. I was walking in the street. I was heading somewhere. And someone in the street just said, I didn't even look at them, or like, I don't know. I don't know who the person was, but he just pretty much said, "Oh, you're so beautiful, but you're fat." And like wow. That was so I don't know, was so shocking to me.
Traumatic.
I never heard someone, I think shocking.
Yeah.
Because I would expect someone to say that I was pretty, that which I was already used to listen to, but not the other side of the coin, that I was fat. And I wasn't actually too fat, but probably much fatter for the normal ideology of the female perfection of a woman, beautiful body. So I think that was just a very important turning point for me. And the same day I went home and I told my mom, I need to go to the gym. I need to start working out. But in my head, I didn't still have any habit or anything that wanted to change just yet. I was still in my just old habits, things that I wouldn't be. I was enjoying exercising, but I wasn't very engaged with it. I was still coming back home after the gym the first few days, and I was still asking my mom to prepare me some pizza or something nice and high in cheese and carbohydrates. So until I started engaging in much more depth with the training and all this fitness industry, is when I obviously changed my body completely. I lose a lot of weight, but I went to the other side of the story. I was obsessed with food. I was completely looking like I was only living on lettuce. I remember tuna, and just I think pretty much that I was really restrictive. I was scared of gaining weight. I never went anorexic, but I think I got to a point where I was actually bulimic. I was avoiding eating things that I knew were high in fat or high in calories, and I would pretty much be all the time stressed about going out or having social events or things like that, because that was just a point for me to be either completely restricted or binge and had no restriction in that. Go completely crazy and then feel so bad about it that I would leave or hide in the same party and go to the toilet and try to get rid of as much as I could.
Wow.
So that was really, really kind of a turning point for me to say, I don't think this is the right thing to do. This is definitely not healthy for my lifestyle, for my head, for anything in general. Like I'm not enjoying life. It's not okay that I'm constantly struggling with food, struggling with socializing. I'm always thinking about what can I do to prevent gaining weight, or even like if I had something that had extra calories, let's say hamburger or pizza or something like that, they're quite high in calories. I had already in my head, if I had just a little piece, that my thighs were already full of cellulite. It was something that straight away I felt like I had gained 3 kilos.
So
and it was only in my head.
Yeah. It became a mental thing. It's fair to say that what that person said to you was stigmatizing, right? If you're at a party and you're eating something and then you're going to the bathroom, were you like vomiting or what? You said you would go to the bathroom to try to get rid of it. Is that what you were doing?
Yeah. I was trying to vomit as much as I could to kind of go to the same level when I started, but obviously you can get rid of everything.
Yeah. So this brings up a very interesting question here, and given that person's comment and given some recent events, we know the Tess Holiday cover for Cosmo sparked a lot of outrage in some circles that this is the health at any size movement. This is promoting obesity, and a lot of people came forward and said, Bill Maher and some other people, they said that we need to start stigmatizing people more. We need to start fat shaming again. And some people they make the argument, if we start fat shaming, maybe they'll start to go on the path to lose weight. You lived this. I mean, this is something where someone literally fat shamed you and it caused you to start losing weight. Now, yes, it did go to the extreme side, but I'm curious, how do you fall on this topic? I mean, do you feel like in some cases, stigmatizing or fat shaming will lead to weight loss? But I mean, can it ever be healthy? What's your take on it?
Look, now that I've gone so far ahead on my degree and my experience, I would say that that is not a nice strategy to go against people's mental health, psychology, to try to force them or push them to do make a change. I think there are better ways to promote healthy changes and transform people's lives. Obviously, there is we need to be aware where they at, like in terms of the readiness of change for change. Because, like, if you know the person is still in a pre-contemplation mode where they're not ready, they're not even aware. The first thing is just pretty much raising awareness of where they are, what are the risks, rather than shaming or criticizing their body or what they have that is not, it doesn't fit with the normal society. But it is a thing that is, I think, the more we work on people's mindset, and it's pretty much raising the awareness and treating them with kindness, with compassion, you actually teach them that they can change, but eventually they have the final word.
No, I completely agree with what you're saying. It's that comment you received, it did promote change in you, but it wasn't healthy change.
No, absolutely.
Yeah, it's just curious because you lived through it, and so which brings me to my next question: is that women have a higher pressure to look a certain way than men. This seems to be amplified even more inside the fitness community. What can women do to feel more confident in themselves and live a healthier lifestyle, but without the pressure of having to fit in or look an exact specific way?
From my experience and as women, I think the main thing is start recognizing your qualities. And obviously, it is a process and is something that requires patience and practice. But a lot of the things that requires to get out there and feel confident is just start from a self-love and self-compassion perspective, and start loving yourself, regardless whether you are obese, overweight, or very thin, whatever you are. Main thing for me is, do you love yourself right now? It doesn't mean that you can try to change or want to be better, but you need to start, your self-confidence and your self-esteem need to start growing from the self-love point of view. So for my own story is that I used to always like think about, I'm going to be happy when I am shredded and when I am fit. But actually, when I was at that point fit and shredded, I was so unhappy. I was still not happy. Mm-hmm. You're never comfortable and like happy with the body you have if you're not really coming from a self-love. And I just didn't like my body. I was only just thinking about, I want to look like someone else. I would like to have the body that this girl has, and I don't have that. So once you start and stop comparing yourself with other women, and just like pretty much doing like a self scan and discovery of your body and saying, look, all the things that my body does for me. So many people they don't even have legs, or they don't even have, like, how many women would love or to just have my own perfect body, but being able to enjoy life and be happy. And I've seen so many women that have achieved happiness in their own skin, regardless whether they are shredded, or they are obese, or they are overweight. And it comes from that sort of self-confidence that like burns within you, and then you decide to, okay, you know what, I love myself, but because I love myself, I want just to lose weight in a sustainable way that is going to benefit my health. It's going to make me feel better. It's going to give me more confidence. But I don't mind the way I am. And that's the main thing. That's the turning point of how much do you care and self-love yourself from the first point, from the first day until you decide to make a change. But you're still you're still around a self-compassion environment.
Yeah, I think you really hit the nail on the head there, and it's the comparative aspect, right? It's I can speak from myself, competing for 5+ years. It's one of those things where you're never quite satisfied, and you're always like, oh, if I'm shredded, I'll be happy. But you get to that point, and you're not actually happy, and you're being like, you see somebody else, and you don't see that in yourself. And I think that's something that is amplified again for women above what we see with men. I mean, here's the question I'll pose to you is, how do women find better camaraderie? How do they find compassion, companionship inside the fitness community, instead of always seeing somebody else as their competition, right? Or someone that they have to beat, or someone that's against them, right? What steps can women take to start to find some unity with each other, as opposed to seeing someone being like, oh, she's, I need to beat her?
Well, for me, basically, is deciding who you want to look in terms of in your websites, in your social media, who you follow, and like shaping your environment to like a something that is goes and aligns with the changes you want to make and the things you really need and are going to be beneficial for your long-term health and mental health as well. So it is just pretty much deciding, you know what, I'm going to unfollow all of these pages that they just make me feel or bad or trigger me to think that I'm not good enough, and I'm just going to follow things that actually empower me and make me feel more confident. They promote health, they promote self-love, they promote self-compassion, they promote strategies that actually empower me to be better rather than trying to look for what's the quickest solution to change my body, or making me feel that I'm not good enough, or that I'm a failure, that I'm not able to achieve something I want because I'm just in not a good place to start with. So that's the main thing for me. That is just changing your environment and who you follow.
Yeah, absolutely. We're a product of nature and nurture, right? And I think you hit the nail on the head there, and it's being very cognizant and being aware of maybe the pages that you choose to follow. I can't think of the study offhand. I'd have to pull it up, but I remember basically it was a social media study, and they looked at women who followed specific accounts that were just that typical fitness celebrity, buy my products, here's the latest booty workout, and, not really anything evidence or science based. And what they found in this study is, for women, although these pages may serve as a level of inspiration at first, long term, they actually become incredibly mentally damaging to the people that follow them, because they don't know that they compare themselves to something that's photoshopped, to something that's edited, or someone who's possibly taking steroids, or has a personal chef, and they're constantly comparing themselves to this unrealistic expectation, and they buy the crappy supplements, and they buy the detoxes, and the fix it fast type stuff, and they don't get the results that they think that they're going to get, but they're being sold lies. and they're being set up for failure by this. And and that's why for anyone that's listening or watching right now, I highly recommend following Astrid, the anti-diet dietitian. She's someone who promotes health first, and it's always science, objective, evidence-based stuff. So highly recommend you follow her. This is something that I see even with my fiance on a regular basis, who she's guilty, as a lot of women are, of following pages that just say, like, follow this workout today, and then it'll be completely different workout the next day. And she's always showing me her phone and be like, is this accurate? Should I buy this supplement? Should I do this? Is this celery juice actually going to give me results? And I'm like, no, like, you need to dump these pages, right? And that kind of leads me to my next question. We see the growing trend of, especially in the supplement industry, of pushing products, proteins, pre-workouts, supplements that are designed specifically for her, right? There's this growing trend to, market products specifically for women. Is there any real value to these, or is this just a marketing gimmick?
I would say, for the most part, most of these products are just marketing in a way to make it more expensive or more attractive for women. But let's say, for example, let's look at the vitamins section. Sometimes there's like when we compare vitamins for women and male, they a little bit adjusted for the female requirements as compared to male. But that's just vitamins. But when it comes to actual products that we see in the market as protein powders, pre-workouts for hair, it is more like it is definitely something that is mainly a way to capture the attention of this population that they just ravenously hungry for quick changes, and they will feel like if this for hair, this is like this is for women, it is going to be much more efficient for me if I use that product instead of a regular plain product that it doesn't say that is for women, because everything in the market for any products is is gone to these like categories of either female or for male. So if there are products as well that are targeted to female, it is women are more likely to buy them.
Yeah, for sure. I think that's true of really any sort of marketing. I know studies that look at large household decisions, like let's say someone was to buy a home gym. I know market research tends to show that women are always the deciding factor in the yes or no of purchasing or making large purchases. Now, speaking of, supplements that are designed for her, or supplements that are designed for him, I've also seen on some pages, some accounts promoting exercises that are specific for women, or exercises that are specific for men, right? And we hear this age-old thing in women or girls, or well, let's say inexperienced people, newbies coming to the gym, especially women. They always say, "Oh, well, I don't want to work out because I'm afraid I'm going to get bulky," or "I just want to stick to machines and cardios doing cardiovascular activity because if I lift weights, I'm going to end up looking like a man." Walk us through that. Are there any exercises that women should be specifically avoiding, or are there any exercises that women should be specifically doing?
Well, we could say for this question that women and like men and women are we're still the same. We're not like little men or something different to men. The only thing that makes us a bit different is the hormonal component that will have our menstrual cycle that was going to lead to some weight fluid retention at some point, some mood changes, and things like that. But overall, when it comes to building muscle, responding to training stimulus, female are actually pretty good at responding to everything the same as men. I would say there is no single workout that will be or should be different from male to female. Obviously, it depends on individual goals, right? Let's say you want to be like if your goal is to be stronger, doing every single exercise that men does is pretty much going to be result in the same benefits for a female. If your goal is bodybuilding, you probably need to work a little bit more in your booty or a specific part of your body that requires a little bit more work. But it doesn't mean that like fat loss is going to be targeted to spot reduction in certain parts. But you can build a bit more muscle in that specific area and change the shape of it. I think it is targeted to the goals, specific goals of each person, but there's no difference. Like I see myself and I train really hard, and it's not like I just go to the gym and do cardio. I do go and lift weights, and I'm working on weightlifting. I'm trying to have the same goals of trying to go on a little bit heavier tomorrow. And female have this, a lot of women have this fear that if they lift weight, they will become bigger or bulky. And that's not true, because firstly, we don't have testosterone that same as men. That's the only hormone that would probably allow you to grow a lot. But even if you had testosterone, you have to have a calorie surplus. You have to have like a lot of different factors aligned to really become bulky and like grow really big. Like it is actually the opposite. When you lift weights, you lift heavy, you build a little bit of muscle that actually helps you to look better, in better shape. Your body completely changes, and it actually looks more feminine. So it is completely the opposite. And I always encourage women to lift weights, go heavy. That's not going to ruin your body. It actually is going to change it for the better.
Yeah, absolutely. I couldn't agree more with that statement. And it's great to have you confirm that and give confidence to all our female listeners that it is perfectly safe to go in there and lift weights, and you won't have the negative fear or side effects that some of them have in their head. So ladies, get in there, lift some weights. You'll look better for it. Or you'll feel better,
Absolutely.
So now, one of the other things that comes around with that as well is the notion that you'll hear, especially in relationships, women complain that, oh, well, he's a guy, so he loses weight faster than me, or it's easier for men to lose weight than female. Is there any truth to this?
I would say women might struggle a little bit more in terms of body weight, but not necessarily body fat, because of the same things I just mentioned before about the menstrual cycle and how it can affect body weight fluctuations throughout the week and throughout month to month. Like if you compare maybe a chart of body weights, of daily body weights in a female, and you do the same with a man, and you put them in the same sort of accordingly calorie deficit for each one of them, that is going to allow a certain amount of body fat to lose per week. Mm-hmm. You're going to notice that they both can achieve the same result, but perhaps body weight in terms of body fat, but in terms of body weight, you might see that women struggle to see that scale dropping much more quicker because of the same issue. In women, as compared to men, there is much more variety and much more fluctuation week to week. because of the response of not just the actual hormones, but women are more prone to be affected by emotional stress, like psychological stress, which obviously increases cortisol hormone that can increment the fluctuation of this water retention.
Mm-hmm. Now,
so fat is the same. Fat rate can be the same.
Yep.
It's just that it is really hard for a woman to internalize that they're having progress, because they just see the scale number stalling or going up, but they're not really looking at the whole picture, or they're not being patient enough to actually see the progress.
Right. No, I do agree with that as well. So I want to segue into some questions that I received through social media, specifically focusing in women's health. And this is a question that I got from a lot of people, and it's very simple. Can I work out when I'm pregnant?
You definitely can. It is actually quite beneficial for women to work out. Obviously, the intensity and the volume needs to be adjusted accordingly for the stage of the pregnancy, and make sure the exercises are safe and are not increasing the pressure, the intra-abdominal pressure, or anything around the area where the baby is growing. But definitely it's something that actually prevents preeclampsia, which is like hypertension throughout the pregnancy, and it reduces the chances of having pre-diabetes or diabetes throughout the pregnancy or after pregnancy. So exercise definitely is always good in all the stages of a person's life, including pregnancy. Adjusting is always important to adjust the intensity, volume, frequency, and the type of exercise you choose. But overall, like a little bit of cardio, no high impact exercises, decent amount of reps and sets of exercises targeting a specific different part of your body are completely safe.
Now, is this something you would still recommend if the person had never worked out before, right? Let's say they might be a little bit overweight going into pregnancy, and that's what they want to get healthy. They want to be healthy for the baby, and they decide to start working out, and they've never done it before that. Is it still okay for them to go into a workout routine at that point, or is that something they should wait until after?
No, absolutely. I think it is actually a good decision to, like, if they never worked out before, they can do that. But again, adjusting for intensity, maybe starting step by step, little by little, and being aware that obviously you don't want to go all in 100% on intensity, but you can still do get a lot of benefit out of it. And if you actually have some overweight issues, you are promoting some of these good benefits and results from exercise. The exercise itself has a lot of benefits, not just mentally, physically, but in a muscular level, hormonal level. It's going to make the pregnancy much more bearable and I would say just easier to livable to get throughout it, and being able to survive in a nice way.
Being able to survive. Okay, yeah. So after they have the child, after they've given birth, how long or what's the standard wait time to get back into that sort of lifestyle? Can they jump right back into it, or should they take a little bit of time off to recover and then start working out again? What would you prescribe?
Look, after women have given birth, they have a period of recovery. Mm-hmm. It is not potentially recommended to go straight into workouts or things like that. But if you think about after you give birth, you want to get back in shape and recover your previous body before pregnancy, right? but it might take, and ideally you want to take a year for it as well. Because the first few months, you probably won't be able to prioritize your body as the main thing once you had a baby, and especially if it's your first baby, you kind of want to give all you have to your little creature, your baby. You want to nurture and breastfeed and dedicate time to create this big like bonds that you get with your baby for the first time. So from what I've seen with my clients, you pretty much should try to allow at least a year or 9 months to start getting into exercise, or perhaps after the fourth week you've given birth, just very gently, because everything is pretty much very delicate down there. So you want to go and pretty much work out your muscles, your core muscles, nothing high impact, nothing that it can be risky in terms of getting maybe putting into risk anything that is just down below. So you want to really be gentle and careful with it. Progressively, as you recover, as you go, as the months go by, you can start thinking about maybe, all right, this is a better time to perhaps just focusing on doing a small reduction of your calories in that sense if you're not longer breastfeeding. But you really want to have a really good quality nutrition while you're breastfeeding, because everything you eat is going to be transferred to the baby. So you want to really focus on the quality of your nutrition. It's not a time for weight loss. Your body will automatically start losing some body fat and some body weight as it recovers and it adjusts. The hormones go back to normal, and you're breastfeeding. Everything start returning to normal as if you do give your body enough time to recover. You choose your nutrition wisely. You're not eating crazy things. So it's not like once you gave birth, you should go all in and eat everything you didn't have when you were pregnant. So it's being mindful of your nutrition choices. And give time, be patient and give time, that everything has its priority at its own time. The first few months, enjoy the time, form bonds with your baby, and it will come the time that is appropriate to start going back to training, going back to exercise. It doesn't mean that you might not be good for a walk or for gently exercising your muscles or your core, your pelvis, everything that is going to help you as well to reduce maybe low back pain or like just muscle aches. And especially if you come from a background that you've been training quite often, quite a lot, or you're athlete, it is going to be a bit more challenging to kind of step back for a while, prioritize your time with your baby, and then come back to training. But it is very individual, and I guess every person will kind of gauge how they feel, where they at, and maybe start slowly progressing. But always go to your doctor and ask them whether they feel like they're in a good time for going back to exercises.
So one of the things you mentioned a couple of times there was breastfeeding, and it's something I never even considered until you just pointed out. Let's say a woman does decide to go back to the gym in a short period of time and she starts taking supplements again. Is that something that's safe to do while breastfeeding?
It depends what supplement you're talking about. Like, let's say you said you're just using whey protein. It is completely safe and fine to use that. I wouldn't go and have like caffeine or fat burners or pre-workouts or things like that, because they tend to be like a proprietary blend, quote unquote, magical things, ingredients that you don't know what effect they could have in your blood pressure, in your in general in your health, especially you don't know what sort of substances can be absorbed and still kind of live in your bloodstream for quite a while and can be transmitted to the baby. So I would say safe is if you're consuming products that are nutritionally convenient, but still like are considered foods. Let's say whey protein or casein, something like that. It is still something. It is a food, but it is a convenient food that you can use, but nothing like strange that you're not sure about. That you don't know what's the life or how can their effect in within your bloodstream and how can they be transferred to the baby, because every the milk you produce, it is pretty much part of your plasma, your whatever is in your body can be transmitted in the through the milk, through the breastfeeding to the baby.
Right. Thank you for that answer. I appreciate that. So speaking of pregnancy, roughly 10% of the women that can give birth will end up with PCOS. For those of you who are unfamiliar with this is polycystic ovarian syndrome. So in your experience, what is the most effective approach for dealing with something like this?
Well, it is quite strange that you only mentioned that PCOS is after giving birth. Actually, the most common way to find PCOS is not just after pregnancy, but actually around puberty. Really? Or like in the early stages. 1 in 10 women are diagnosed with PCOS during their lives, and more than 20% of women between 12 and 45 are being affected with this endocrine disorder, especially in this reproductive age, right? So it is one of the most important clinical and public health problems that women are facing. And nowadays, we're seeing more people and more women being diagnosed with this disorder, because before it didn't have the importance or the relevance, or it kind of there wasn't enough tools to diagnose it. Nowadays, it seems like it is taking a little bit more relevance in the medical field, and that's why it is important to kind of address the symptoms, especially the endocrine part of it. In part, this PCOS is largely genetic, so it runs in families, and if your family have it, you're likely to be at risk as well of having PCOS. It can be a thing that can be strongly impacted by environmental factors. Let's say nutrition, physical activity, your lifestyle, apart from having the risk within your genetics. So what I could say basically is that lifestyle strategies can do really well managing the symptoms of PCOS. For those who don't know, what happened with how that PCOS is diagnosed is basically women need to have 2 out of 3 of these criteria. They need to have rare ovulation or lack of these ovulations on a continuous basis, or suffer from biochemical hyperandrogenism, or even have polycystic ovaries, so having cysts in the ovaries. So if you have 2 out of 3 of these criteria, you probably are more likely to be more likely to have PCOS.
High risk.
So, correct. So one of the most common things you see in PCOS is insulin resistance. So when we talk about PCOS, a lot of women will have insulin resistance for all this endocrine disorder that is going on inside the women's body. So we want to pretty much the main or the targeted action towards the management of the symptoms and the disorder is trying to control the insulin resistance. How you do that? You basically, by usually, if you lose 5% of your body weight, if you're overweight, can be very beneficial because that increases the insulin sensitivity. In addition to that, you might find that exercise itself is going to be quite beneficial for all the things we have already discussed in terms of body composition, mental and physiological effects in the body. And in addition to that, I don't know whether you've heard so many myths that are targeted to women in terms of you can no longer eat carbohydrates,
Yeah.
you have to go vegan, you have to eat gluten-free. The more things you cut out of your diet, the better for you. And all of those things are 100% untrue. And I dedicated a complete article in Allen's Aragon, a monthly review, where I pretty much debunked every single of these myths, and I can go over them if you want to.
Yeah, absolutely.
So one of them is if your menstrual cycle is irregular, you have PCOS. Sometimes menstrual cycles can be irregular, and it doesn't mean that you have PCOS. It can have heaps of factors and I can be a testimonial of that. I have such an irregular periods, but it doesn't mean I have PCOS at all. Everyone with PCOS will be obese or overweight. Not necessarily. So there's an amount of people that might be overweight and obese, but there are also women that struggle with PCOS and they're not necessarily obese. Insulin resistance in PCOS causes weight gain. It might make a little bit more difficult the weight loss attempts. It doesn't mean that if they go in a calorie deficit, they can lose weight. It is just finding not just the balance or the right amount of deficit that can create a specific weight loss. But in addition to that is considering the whole picture. So what's the person's lifestyle? What is their nutrition like? All of these things at the same time can impact or make it easier or difficult, as well as their non-exercise activity thermogenesis. So many people say, well, I struggle with losing weight, but and I'm going to the gym and doing everything right, but they don't even actually try to think about this unintentional exercise or physical activity. They just sitting down all day, they moving less.
Yeah, it's something like being in a perceived deficit instead of being in an actual deficit.
Absolutely, yes. Some other myth that you might hear about PCOS is that soy is completely, you should be avoiding completely anything that has soy. And there's actually no current evidence data to support that restricting or avoiding specific foods based on soy will improve or reduce the symptoms of PCOS. It, in fact, can be beneficial in some cases. Otherwise.
Yeah, I absolutely agree. Bill Campbell just put out an excellent post on soy, and the meta-analysis was geared towards men, not women, but in the meta-analysis on soy, it found no negative health impacts in men and hormones. So absolutely agree there.
Yeah, and the other one is like you must eat gluten-free, because gluten-free increases your chances of being inflamed and has inflammatory processes inside your body, and that's going to make you gain more weight. So if we think about it, gluten-free is mostly indicated for celiac patients, people that have a genuine allergy to gluten. Not necessarily, it doesn't mean that some women might not have certain quote unquote intolerance to gluten, and it's more so like like an intestinal and or IBS response. So you have some inflammation in your bowels, you might have some flatulence, some gas, some diarrhea, but that doesn't mean you actually you have an allergy to it. And it doesn't relate to weight gain or weight loss. It actually, if you have celiac disease, you actually lose weight because you're not absorbing anything. Mm-hmm. So it's the opposite. Not like if you eat gluten free, you're gonna go and weight gain. So it is weird, that statement, but I hear it a lot and I've seen it in so many Instagram pages, and that's why I put it out there. Also, dairy is bad for you if you have PCOS, and it also is the one that causes acne. In this one is part true and part is not true. If you have some tendency to suffer from acne, sometimes dairy can increase some of the genetic pathways to increase the acne production. It doesn't mean that it's going to affect everyone. So to make this recommendation, you gotta know the patient and have their history and their background in terms of how likely are they are from suffering from acne. The other one that is very common is to tell them avoid carbohydrates at all because of the insulin resistance. And this is also told to diabetics. Why not just go low carb, go keto? Keto is really good for you because you're not going to have any carbohydrates, and being on a ketosis is going to get you to lose weight faster. And we've seen already a lot of data backing up that what makes you improve your insulin sensitivity is exercise, an adequate calorie deficit, and choosing good quality foods in general. Keto is not going to make a difference. It can help at some point, can help some women if that's going to help adherence and consistency, but it's not going to make a huge difference. You could benefit still from going lower carb and not completely avoiding all the carbohydrates from your diet, because that at the end of the day, if it's not it's not within your diet and your habits, and you're changing completely your diet because of an ideal diet, you're going to be likely binging at the end of the diet, or regaining the weight, or destroying your relationship with food.
Oh, absolutely.
Yeah. And the last one here I put and I found is like, well, you better go organic, because if you eat organic, it is a more clean food. It doesn't have pesticides, and it won't affect your it will make your life easier if you go organic. And we've seen in many new recent research that organic is no better than conventional foods. Yep. And it actually can just make it much harder and much more expensive to live by organic, and not see real difference, to be honest.
Yeah.
So yeah, all of these things.
I totally agree with that. That's something that organic and non-GMO and all these things get promoted as improving health, and the only thing that it's improving in most cases is shareholder profits, right?
Absolutely.
So that's actually going to wrap up our time right there. So Astrid, tell everybody where they can find you.
I'm very basic, and I tell everyone just to follow me on Instagram. That's kind of my main site where they can find most of the things I put out there. A bit of my there's some links to my LinkedIn if they want to follow and find a bit of my background. And I have all of the different nutrition coaching programs I have to offer. And like, if you just want to get in contact with me, just send me a DM and we can just have a chat.
Fantastic. Sounds good. Astrid, thank you so much for being here with us today. I hope our listeners and our viewers found your information helpful. I found it educational, so thank you again so much for being here today, and I hope you
It was a
enjoy the
pleasure.
rest of your day.
Thank you so much. It was a pleasure.
Thank you.